medical matters now, delayed appointments, waiting lists, lack of staff, strike action. You put it all together and you get trouble for the NHS.
Yes, so now desperate patients have been forced to ditch the NHS and seek treatment abroad, which is not only pricey, but also, well, we're asking this morning if it can be fully trusted.
I think a lot of people they're jumping the queue, they're getting things done differently. So say it's a hip replacement or whatever, they feel that they can get it done much quicker, but they'll have to pay for it, or their insurance will have to cover it as well. Two doctors will join us now. The founder of the Esho Clinic, Dr. Tijon Esho, and Dr. Bhasha Mukherjee as well. Yeah, I need an operation to get both those names out. Hey, absolutely. Very nice to see you both. Anyway, how are you seeing the way people are thinking and what's happening?
I'll let the lovely lady go first.
I think we have to think about the patient's perspective as well. From my experience, the patients I've seen come in to see me who've had surgeries, procedures done abroad, they simply are tired of waiting. And for somebody, it could just be a case of, do they stay off work and wait for their knee operation for several months? Do they lose function altogether? Or do they go on a holiday, essentially, and get a procedure done at the same time? And I think we also need to question, where does our bias come from about thinking that practices done abroad are not trustworthy? Is it based around xenophobia? Because we are, in the NHS, getting doctors and employing doctors and clinicians from these countries as well. So, I don't know.
Well, Dr. Mukherjee, we do hear the horror stories, don't we, though? We're in some places in Turkey having botched procedures, and, in fact, practitioners here in the UK, and perhaps you're one of them, Dr. Esho, warning about some doctors overseas perhaps not regulated in the same way, perhaps offering cut-rate prices, but giving cut-rate services as well. I mean, what's your view? Can we trust overseas clinicians?
Yeah, so I agree with Dr. Mukherjee here in terms of the fact that we can't just say we're the only place that has great doctors and great medical care. We're one of the best free health services in the world, but there are expertise all across the world. So I think she's completely correct with that. What my concern comes with when the shopping for expertise comes based on price and not how good someone is or where that is. This is where we see the situations where things go wrong, because when something is very, very cheap, often or not, it's because there are things that have been left out that will be compromising the safety of the patient, whether that's the experience of the practitioner, the circumstances of the follow-up, all of these things come into play. So for me, surgical tourism or medical tourism is a need because the system is overrun.
But they're not leaving out an anaesthetist or something like that, are they?
It could be. It could be in certain circumstances where we've seen that people should undergo a general anesthetic, that they're going through a more risky operation under local anesthetic just because it's a much cheaper way of doing it, or using sedation where they could run into problems and more stress on the body. So again, they can have these procedures done, but it's really important that are following the best expertise.
Dr. Mukherjee, it's the ones that are more visual, so people can't really see whether a hip operation's right or wrong, or whatever it is, but like say dentistry.
Oh yeah,
you get your teeth, and
they come back with daggers instead.
Yeah, they're sticking out to the left, they're sticking out to the right.
I've actually had dental procedures done in Turkey, and I must say that yes, I do think that shopping around for the cheapest option might not necessarily be the most. It might not be the best way to do it. But there are research websites where you can go on to see government-regulated companies, dental companies, and medical companies, and there is more awareness about this as well. And actually, we have to understand that just because a procedure is being charged for more in the country does not necessarily mean it's better either. I have definitely encountered private practitioners in this country who might have obtained their injecting license from a 2-day course, and they're going around doing injections. I know a lash artist who just went and did a 2-day course and started injecting Botox in people's faces and various other areas. And we are also seeing those complications come into the NHS as well.
Well, also,
So,
I mean, is it just private clinicians, as you say, perhaps sort of underqualified? But, you know, when you think of all the pressure that the NHS is under, whether that's through strikes, whether that's through, you know, just too much demand in A&E or whatever it might be. I mean, Linda's just got in touch via Your Say on our new portal on the website saying, I actually think the British NHS is no longer fit for purpose. I'd question whether it's safer in the UK. Is that a fair point, Dr. Esho?
I think it's a bit of a harsh comment. I understand the frustrations. You know, like I said, we've got one of the best free healthcare services in the world, but that comes at a cost because the growing need, the growing expectation of what it's supposed to provide, the growing ages of the patients there and the demand, you know, it's very, very difficult. Myself, I had both parents with cancer. My dad unfortunately passed away a year ago. And, you know, the service and the care that they got by the NHS, both of them, was phenomenal. My son, we almost lost him in COVID at 15 months old, and I don't believe he would have got that care elsewhere. So it does a lot, but sometimes we do focus on the negative.
Let me ask you, why has Turkey come to prominence in all of this? I mean, we're not hearing people are going to America to get these treatments done, or they're going to Iceland or whatever, but we're hearing Turkey all the time. Why have they got availability on this?
I think it's not just availability, but practicality. You know, to get to Turkey is much easier than to get to the States. And so then again, coming into cost, you know, I've seen packages where for £500, someone has a hotel, flights return, their procedure and come back.
It's not France, as Eamon says, even, or Spain. It does seem to be Turkey. And I understand for hair transplants, it's really popular because it's a huge thing in Turkey. Baldness is kind of like...
Are you suggesting the doctor should be
I'm not making...
booking a ticket?
Sorry, no, my brother is bald and proud. I don't have a problem with baldness.
I'm too far gone.
In Turkey, people apparently do have a problem with baldness, and at some of the clinics, they do 40 to 50 procedures per day. So they are actually international experts at it.
And are they sort of slightly phobic about baldness?
They're phobic. They love a hairy man. So they have the big moustaches. They're all about the full head of hair. And that's linked to kind of success in the mindset there, which is why I think Turkey's come to prominence for that. But I don't know about teeth. Maybe they'd like a $1 million smile as well, or whatever it might be. But that's in answer to that question. You might
I think there's a big awareness and targeting in campaigns for places like Turkey. You know, they're one of the first places, or there's many other options, as you say. But when you look at surgical tourism, you look at salespeople that base themselves in the UK to help ship people to Turkey to have operation, it's a much more sophisticated operation. But with that, just as my colleague has said, in the UK, where we've seen problems with poor regulation, we're seeing a lot of that there. When there's a big growth point, then there needs to be regulation. And I think it's harder for the public to understand where it's safe than just my learned colleague there who had gone for her teeth. You know, we still need to do more. We are signposting and educating the public, particularly with Turkey, in terms of where there are great places to go to and what to look for. But I don't believe we are there yet. And opening that gateway just to say, look, abroad, go, I think leaves, you know, the NHS will pick up the pieces in the end, because when these go wrong, as my colleagues have probably seen them working in A&E, where else do they go? You know, they come back here, and we're not going to turn them away.
Well, we'll go and see people like you guys. Thank goodness you're there. Thank you very much indeed. Just an interesting thing, the way the trend is going. Thank you for discussing it with us today.